Hi, Scott Popp here, and I want to talk about core activation. These are buzzwords in rehab and physical fitness and CrossFit that most people don't fully understand what core activation is. Activation is a timing aspect of muscles in your core, especially at the deepest levels that stabilize the spine. So when your spine moves, it has stability. It has function and stability. The deepest layers of muscles are called the multifidus muscles. They go between one or two segments. They're very small, little deep muscles in the spine that have quick activation, but they atrophy very quickly from injury. And so a lot of people that have chronic back problems have atrophy of these deep muscles, and they do not activate fast enough, and they're not strong enough to stabilize their spine, and their outer muscles become the primary movers. When the disc is unstable, it tends to create a lot of stress in the disc, and that causes bulging of the inner material called the nucleus. A lot of us have cracks and fissures or crappy discs, and so there's sloppiness in the inner fluid aspect of the disc, and so it moves too far, and if it gets out to the outer third of that disc pad, it becomes painful. Now, we don't activate the deep core muscles typically with just general exercises very well. One of the big problems with what happens in modern society is we walk around on these flat surfaces. The deep muscles are activated by proprioception, balance, and coordination primarily. They're not activated as well just by lifting weights. What we do in CrossFit is we go and we need those deep muscles, but we essentially have weak systems because of poor sensory aspects in our environment. We still live in a very benign world. Our sensory system, especially through our feet were designed for contour. They were designed to walk up and down mountains barefoot. They weren't designed for these flat surfaces very well. And so we get a sluggishness of those deep muscles. So A, they become weak, and B, they don't fire fast enough so that they don't kick on in time to create stability. Now, a great way of activating your core muscles is to use unstable surfaces. This is called the bazoo ball. And in CrossFit, and one of my patients are doing what I call high load, high volume repetition work. What they need to do is train themselves on unstable surfaces. So just the act of balancing on the bazoo ball can be challenging, but what we want to do is mimic the movements that we're doing in CrossFit. So let's say we are going to do a clean, hang clean. You want to practice this on an unstable surface. Hang snatch. Practice this on an unstable surface. Squat, overhead squat, unstable surface. Going up and down like this. You can add asymmetry to your unstable surface using a kettlebell. The unstable surface then promotes a lot of incoming information into the nervous system, and you can do a squat, a thruster, you can do all sorts of variations, and I would always try to do them asymmetrical if possible. You can do a snatch, a thruster, clean, many varieties of movements. Now, if you don't want to do high load activation, you can do yoga postures on the bazoo ball. Yoga postures such as the Warrior 3, where you bend forward and work on stability. These are for people that don't actively exercise. Two ways of injuring yourself. Low load, brushing your teeth in the morning, your back goes out. High load, CrossFit, high load activities that incorporate lots of volume. So you want to train the incoming information both ways. Go to yoga class, low load, do yoga postures, low load. Also remember, always do these things barefoot. These bare feet increase the amount of sensory aspect up into the nervous system. One other way to activate your core throughout the day is practice pulling in your belly button and grasping the floor with your feet. When you grasp the floor with your feet on any type of unstable surface or anything just even any surface throughout the day, it stimulates and tonifies the deep multifidus muscle. Just remember, the common denominator with people with chronic back pain and recurring injuries is they have atrophy of their deep multifidus muscles, and they're very sluggish on activation, so the inner muscles don't work, and the outer muscles are doing all the work, and the disc is inherently unstable, and so you're re-injuring yourself all the time. I've had many patients that until we started activating the core on this type of exercise program, my wife included, they were not able to recover from their back injury. So thanks for watching. Get on the Bowsy ball. Any type of unstable surface, you can buy rocker boards, wobble discs. Sporting goods stores are now starting to have these. Anything that creates instability, and go barefoot. Have a great day.